everyone, welcome to our channel. Today we are going to talk about an important health topic, hearing loss. Hearing is a vital part of our daily lives, and recognizing the signs of hearing loss early can make a big difference. Hearing loss can affect people of all ages. Understanding the symptoms is the first step towards addressing the issue. Here are some common signs that you or your loved one might be experiencing hearing loss. Firstly, if you find it difficult to understand conversations, especially in noisy environments, this could be a sign. You might notice that it's harder to follow what people are saying when there's a background noise, like in a restaurant or at a party. This difficulty arises because hearing loss often affects the ability to filter out background noise, making it challenging to focus on a single conversation. Another symptom is frequently asking others to repeat themselves. If you often say, "What?" or "Can you say that again?" it could indicate that you're not hearing everything clearly the first time. This repetition can be frustrating for both you and the people you're talking to and might lead to misunderstandings. You might also start turning up the volume on the TV or radio louder than usual. If others are complaining that the volume is too high, it might be because your hearing is not as sharp as it used to be. This is a common way people compensate for hearing loss without even realizing it. Trouble hearing on the phone is another common symptom. If you find phone conversation difficult, it might be because you're missing some of the sounds. Phone often eliminate certain frequencies and reduce sound clarity, which can make it harder for someone with hearing loss to understand the person on the other end. Ringing or buzzing sounds in the ears, known as tinnitus, can also be a sign of hearing loss. If you frequently hear these noises, it's a good idea to get your hearing checked. Tinnitus can be a symptom of various underlying conditions, including hearing loss, and should not be ignored. Finally, avoiding social situations because it's hard to hear is a big red flag. If you find yourself skipping gatherings or feeling frustrated in social settings, it might be because you're struggling to hear what's going on. This avoidance can lead to social isolation and affect your overall well-being, making it crucial to address the issue promptly. Now let's focus on children. Early detection of hearing loss in children is crucial for their development. Here are some signs to watch for. If a child shows a lack of response to sounds or the name being called, this could indicate hearing issues. Babies and young children should react to loud noises and turn their heads toward familiar voices. If they don't, it might mean they aren't hearing properly. For example, a baby who doesn't startle at a loud noise or a toddler who doesn't respond to their name might be showing early signs of hearing loss. Delayed speech development is another important sign. If a child isn't talking by the expected age or the speech is difficult to understand, hearing loss might be the cause. Speech development relies heavily on hearing. Children learn to speak by imitating the sounds they hear. If they can't hear well, the speech development can't be delayed or they might have trouble articulating words correctly. Children with hearing loss might frequently turn one ear towards sounds. This is because they might be trying to hear better with their stronger ear. You might notice a child consistently turning the same ear towards the source of a sound or voice, which can be a compensatory behavior for hearing loss in one ear. Not following directions or seeming inattentive can also be a sign. If a child often appears to ignore instructions, it might be because they did not hear them properly. This might be mistaken for inattentiveness or behavioral issues, when in fact the child simply can't hear what's being asked of them. Lastly, academic difficulties that might be related to hearing issues should not be overlooked. If a child is struggling in school, it's worth considering whether hearing loss might be affecting their ability to learn. Hearing is crucial for understanding teachers, participating in class discussions, and even hearing instructions for assignments and exams. If a child frequently misunderstands or misses information, it could be due to an undiagnosed hearing problem. Hearing problems can occur at any age. Let's discuss each point in detail. Newborns and infants. Newborns and infants can be born with hearing loss due to genetic factors or complications during birth. For example, some babies inherit genetic mutations that affect hearing, while others might experience hearing loss due to infections their mothers had during pregnancy, premature birth, or other complications. Early hearing screenings are essential to catch any issues right from the start. In many places, newborns undergo hearing screening tests before leaving the hospital. Early detection ensures that baby with hearing loss receive prompt interventions such as hearing aids or cochlear implants, which are crucial for their language and cognitive development. Children. Children can experience hearing loss due to ear infections or exposure to loud noises. Ear infections, particularly middle ear infections, are common in children and can cause temporary or sometimes permanent hearing loss if not treated properly. Additionally, exposure to loud noises from toys, music players, or environments like concerts and sporting events can damage a child's hearing over time. Regular checkups help catch any problems early, ensuring they get support they need. Pediatricians offer check for hearing issues during routine visits, and parents should be alert to signs such as delayed speech development or difficulty following conversations. Adults. Adults might develop hearing loss due to exposure to loud environments, aging, or certain medications. Occupational noise exposure is a significant risk factor for hearing loss among adults who work in noisy environments such as construction sites, factories, or even music venues. Additionally, age-related hearing loss, known as presbycusis, typically starts around the age of 60 but can begin earlier. Certain medications, known as ototoxic drugs, can also damage the inner ear and cause hearing loss. Paying attention to the symptoms we mentioned earlier, such as difficulty understanding speech in noisy environments or needing higher volume levels on electronic devices, is key to managing hearing health. Adults should have their hearing tested regularly, especially if they notice changes in their hearing ability. Old age. Age-related hearing loss gradually affects both ears equally. It's caused by changes in the inner ear and auditory nerves as a part of aging process. Common symptoms include difficulty understanding speech, especially high-pitched sounds, and need for higher volumes on televisions or on phones. Regular hearing tests can help manage and mitigate its impact, improving the quality of life. Hearing aids, assistive listening devices, and communication strategies can significantly help seniors stay connected and engaged with their environment. If you notice any of the symptoms in yourself or your loved ones, it's important to take an action. Here's what you can do. Firstly, schedule a hearing test with an audiologist. A professional can diagnose any hearing issues and suggest appropriate treatments or hearing aids. Protect your ears from loud noises by using earplugs or noise-cancelling headphones. This is especially important in noisy environments like concerts or construction sites. Stay informed about the potential side effects of medications. Some medications can affect hearing, so always discuss your concerns with your audiologists. Ensure children get regular hearing screenings, especially if they show any symptoms. Early detection can significantly improve their developmental outcomes. Thanks for watching. If you found this video helpful, please like, share and subscribe to the Hears App channel for more health tips. Remember, early detection of hearing loss can greatly improve quality of life. Take care and stay healthy.